So you're looking to get into sonography as a career. Here's the first thing you'll have to know. First things first, you'll have to know exactly what sonography is. And sonography is just basically ultrasound. And ultrasound is a type of imaging modality where we use ultrasonic waves to get the best pictures that we can inside of the human body. You know, a lot of people don't actually know what the correct term for it is, and it's called a diagnostic medical sonography. So this is what you're going to be going to school for. This is what you're going to be looking up in Google to research different programs. And it's a very user-dependent career because it's very dependent on the technologists getting the best pictures that they can and using the transducer probe for radiologists and doctors. Ultrasound is very leading, and it has a lot of different categories that you can get into. There's actually 3 different main focuses that I'm going to get into today, and the different types of concentrations behind those 3 different focuses, and just kind of some leading advice that I have based on personal experience and the reason why I got into sonography. So first things first, we're going to first talk about what the 3 different type of focuses are. And the first one I want to get into is a registered diagnostic medical sonography. It's called this because it's in the general track. I am an RDMS. So the second one I want to get into actually is a registered vascular tech. And this is all about everything else. And the third and last final one is a registered diagnostic cardiac sonographer. So that deals with everything with the heart. So now that you know what the 3 different focuses are, I kind of want to get into the different types of concentrations underneath each one of those different focuses. And the first one I want to talk about is RDMS, and being a registered kind of diagnostic medical sonographer. So that's usually the general track that everybody kind of goes into, mostly because it has so many different types of concentrations and specialties that you could do underneath it. The first one I want to get into is about the abdominal ultrasound. So abdominal ultrasound is basically doing on everything on the human body except the heart and the veins. And that includes the abdominal content as far as organs and livers and spleens and kidneys, aortas, pancreas, all those things, but also in the in the abdominal ultrasound is you could do other things like thyroid exams, which is in your neck, and do scrotal ultrasounds, which is for the men. And the most common jobs that you'll probably be doing when you're doing abdominal or RDMS is probably being in outpatient or inpatient settings, usually working in the hospital or ERs, and you'll be seeing a lot of like people in and out, like with different type of things. So it's a great track to get into if you kind of want to do something that's different almost every single day. You'll be doing a lot of like studying for anatomy and physiology, and a lot of portions for your school is going to be about abdominal and OGBYN. Okay, now that I've covered abdominal, now it's time to get into OGBYN, kind of the track that everybody kind of wants to get into for some reason. And so if you want to go into OGBYN as a specialty, I just want to tell you right now in advance, it is not all about scanning babies, okay, and rainbows and butterflies. For OB, it stands for ovariocentrics, and it deals with pregnant women and dealing with fetuses as well. And don't forget, OGBYN has, you know, the right path if you want to go into gynecology. So gynecology, right? And gynecology is basically just deals with women reproductive systems. So of course, like if you just want to deal with like a baby or like a pregnant woman, you'd have to deal with a lot of ultrasounds with women who even aren't pregnant. So if you want to just strictly scan babies, you're gonna have to deal with vaginas as well. So sorry to say. Some examples of OGBYN includes, I'm gonna put a list up here for you so you can take a look at it. So look at this list. So as an OB sonographer, you'd have the option of working in, you know, women health clinics or dealing with a lot of pregnancy centers. I actually work over at Winnie Palmer, Orlando Hospital. So I love that place. And you know, you kind of just do annual checkups for women. And you know, it's hard to do with OGBYN because usually people like to specialize in certain types of OBGYN. So there's the fetal echoes, and then there's like underneath RDS, and then there's the main job basically, which is just caring for women and mothers and inside mommy's bellies and things like that. And you can actually go into fetus echoing. So, you know, and that's just scanning the heart for babies and fetuses while they're in mommy's tummy. So the second type I want to get into is RVT, and RVT is where you're doing non-invasive exams and ultrasound on the veins and arteries. It's kind of like the cardiovascular system in your body. Basically, those are things that elevate as RVT are some blood clots, DVTs, deep vein thrombosis, in the legs and arms of exams like that. And you kind of rule out different people like who might have aneurysms and stuff like that. And you can also do vascular if you decide to do that, but there's also dealing with how blood flows and stenosis. So the third and final track that you can get into with sonography is cardio or echo, also known as a registered diagnostic cardiac sonographer. And there are different types of specialty exams that you can get into for like adult echo, pediatric echo, fetal echo, which is, basically doing the same thing, the same process, but on a little person. Cardiosonography just evaluates the heart and just makes sure there's no defects in the heart and blood flow. And it's pretty also a straightforward track. You'll just be basically dealing only with hearts and just helping radiologists and doctors kind of get a good sense of what's going on in people's hearts. And like I said, blood flow. It's a very important job to do, and it's because it's a very delicate organ. So whether you decide to go into adult or pediatric, I'm assuming that you'd be developing or looking at difficulties and complications in hearts, which is really crazy. I can't imagine doing it in peds because it's such a small, delicate heart all the time. So that's cardiac. So now that I've talked about the 3 different types of focuses that you can get into and a little bit about all the different concentrations underneath each one, just note that no matter what you decide to do, every single sonographer has to take their SPIs, which is the Sonography Principles Instrumentation exam. And so this exam is a statewide or countrywide test that everybody has to take. And I know that sounds super scary because it's like, physics, I don't know anything about physics. Don't worry, neither do I. I'm terrible at math. So that's not the type of physics that we're really going to be dealing with. Kind of, it's instead of like a mathematical physics, it's more going to be about a sonography physics, kind of like a mental physics instead. It's the type of physics of how ultrasound machine works and like what ARDMS is, and kind of going to each one of those focuses. That's kind of what you're going to cover, especially in your schooling. And you just, like I said, make sure that when you do choose whatever program that you have, make sure that you know what the program offers you after you take your RDMS, or if it leads you to be in standing. And what that means is that they'll allow you to sit in for the exam itself, like you don't have to go to somewhere else to go get your exam done. Now that you kind of have a whole general understanding of sonography and everything that kind of comes along with it, or the steps that you can take to get ahead in any program that you would like, and just make sure you just do your research. Make sure you look into why you want to get into sonography. The day-to-day is kind of like, depending on what, business setting that you put yourself into, the ER can be very fast paced and very busy a lot of the times, or you could work in a clinical setting or at a doctor's office where it's just kind of the day-to-day, the 9 to 5, depending on, what specialty that they focus on, and just kind of going through the motions of ultrasounding. So just prepare to be ultrasounding every single day, all day. So that's always something to look into. You take patients, you get to talk to them. I really enjoy the patient care experience, and that was one of the reasons why I decided to go into sonography itself. I really cared about getting to know people and just helping people, but I wasn't really interested in being a doctor or a nurse or having to complete that much school time. So I thought sonography would be a great track for me to go to. I really love talking to people and helping women and babies. It was one of my biggest passions in life. I love to help people and to make sure that they grow and continue. I want to go on to get into my psychology degree over at UCF. That's one of my dreams. It's one of my purposes, is to just help women and children, or the people who don't have any type of access to basic health needs. Thank you so much for watching this video. I really appreciate it. Thanks for so much for kind of going through what sonography is. And I hope that you enjoyed the profession. It's really female dominated specialty, but I don't know why. Oh, men can scan babies too. So I think a lot of men should get into sonography as well. It's gonna be an increase in jobs in about the next 2 to 5 years. So this is a great time to get into it and to go ahead and see where this career can take you. If it's your passion, then please get it, do your research and just kind of find what works best for you. It's a rewarding experience and it doesn't require a lot of the demands that are asked of nurses and doctors, but it definitely gives you a chance to help in health. So thank you so much and I'll see you soon.